Hello, and welcome to Let's Talk Climate, a webcast series from ecoAmerica, featuring dynamic discussions with local and national leaders offering diverse perspectives. Let's Talk Climate brings forth the latest thinking and best practices for building public support and political resolve for equitable climate solutions in the U.S. I'm Rebecca Rear, Director of the Climate for Health program at ecoAmerica, and today we're bringing you a special episode, the Biden-Harris administration's first 100 days. How did they fare on climate, health, and equity? I'm joined today by Jessica Wolff, U.S. Director of Climate and Health at Healthcare Without Harm and Practice Green Health, and Kineta Sealey, Policy Counsel at the Black Women's Health Imperative. Thanks so much for joining us.
Thank you. Thank you so much. Thanks for having us.
Thank you, Rebecca. Great to be here.
So first off, let's start at the 30,000 foot level. How are you feeling generally about the Biden-Harris administration's first 100 days in office? And Jessica, let's start with you.
I am feeling very positive and very hopeful. The Biden-Harris administration came into office with four priorities: COVID, climate, race, and the economy. And these are all essentially health issues. And we saw right away that President Biden really raised responsibility for addressing the climate crisis to the highest government offices by establishing the two new White House positions, the Special Presidential Envoy for Climate, it's being filled by John Kerry, and the National Climate Advisor position being filled by Gina McCarthy. And in these two positions, they'll really coordinate the work on climate, with one role focused externally on national security and international relations, and the other to work on domestic policy. And then we saw in the first few days of the administration, they rejoined the Paris Agreement, they rejoined the World Health Organization, and they started to undo the rollbacks of environmental protections that were put into place by the previous administration. And then at the end of January, we started to see these executive orders, which really made it clear that the administration was going to take a whole of government approach to address climate change, and that they really understood the importance of health and equity. The executive orders on January 27th included directions for the Department of Health and Human Services to establish an Office of Climate Change and Health Equity, an interagency task force to assess the impact of climate change on the most vulnerable populations, and a healthcare readiness advisory council. And we know the importance of the Department of Health and Human Services, which I hope to talk about more later, related to doing this work to make sure health and equity are at the center of addressing climate change. And I would love to talk about, I want to give Kineta a chance here, but I would love to also loop back and talk about the COVID recovery package, the American Jobs Plan, and of course, the national determined contribution that was announced last week.
Yeah, great, Jessica. Thanks. That's a great, really great summary, I think, of sort of where we are on climate and health and equity. Kineta, why don't you pick us up from there? How are you feeling about the first 100 days in general?
Yes, I must say that I'm feeling optimistic about the first 100 days. This past year with the COVID-19 pandemic has been gut-wrenching, stressful, really, truly unbelievable, beyond anything I think that anyone could comprehend. And we're still in it, right? Mm-hmm. However, it feels like we're making positive strides and making our way out of this pandemic. It's great to have Democrats in the White House and control over the House and Senate with a concrete plan on how to successfully overcome the pandemic, but also having legislation to address important issues such as climate change, health, and equity. It's really inspiring. Black Women's Health Imperative is a national nonprofit organization which is dedicated to advancing health equity, social justice for Black women across the lifespan through policy, advocacy, education, research, and leadership development. So when President Biden declared that advancing equity, civil rights, racial justice, and equal opportunity is the responsibility of the whole government and described it as a moral imperative, it was great. And centering equity in legislation will positively impact millions of Americans. It's truly powerful. So according to the first executive order that he signed in January, Biden wants to pursue a comprehensive approach to advancing equity for all, including people of color and others who have been historically underserved, marginalized, and adversely affected by persistent poverty and inequality. And I think Jessica alluded to some of the executive orders that he had signed, but I just wanted to say, like, interagency, he had established Susan Rice is the Domestic Policy Council in charge of the effort to study systemic inequality and determine the communities that the federal government has historically underserved. And also, what's great, the administration also announced plans to pass legislation to boost investment in historically Black colleges and universities. So, it's great. I mean, I'm very positive. There's a lot of things being done to advance equity as well as health and address those social determinants of health that ultimately affect our health every day.
Yeah, no, agree. Yeah, and I think Jessica, you mentioned Gina McCarthy. She's one of the first people that I heard talking about climate change as an issue that affects our health. And when everyone else was talking about polar bears, she was talking about her grandkids. And I think using a lot of the framework that Kineta just laid out for us, I was hearing Gina McCarthy talk about climate change with that language. And then she's one of the first people. So she instills confidence in me for sure, where she is. And Jessica, were you going to say something else?
I was just picking up, really with Kineta focusing more on equity and disproportionate impact.
Mm-hmm.
One of the things that has been very inspiring about this administration is that they understand the intersectionality of these issues. So, the COVID recovery package was a $1.9 trillion package. It had so many important COVID-19 relief and public health protection measures, but it also included $4.5 billion for low-income home energy assistance, $100 million for environmental justice grants, and $100 million for the EPA to update our national air quality monitoring system to help reduce the air and toxic pollution that contributes to both COVID-19 deaths and climate change. And they made sure that half of that funding was going to be targeted to low-income communities and communities of color who we know are significantly more likely to live with poor air quality and be more susceptible to both COVID-19 and the health impacts of climate change. And we can continue to see them weaving that in. So the American Jobs Plan that was released at the end of last month, their Build Back Better plan, it outlines $2 trillion in direct federal spending and lots of clean energy incentives. But in many ways, it's built around climate action. Because in addition to the specific proposals for clean energy investment, they establish broad goals for achieving a cleaner and more resilient and equitable and just future. Mm-hmm. So they have a goal to 100% clean power by 2035, but they're targeting 40% of the benefits of climate and clean infrastructure investments to disadvantaged communities. And they're ensuring that every dollar spent on rebuilding the nation's infrastructure will prevent and reduce and withstand the impacts of the climate crisis. So the weaving and the inclusion always of climate, health, and equity in all of these major plans they're putting forward. Now we have to hope that that translates into congressional action, and that the bills that actually get passed retain all of these aspects.
Mm-hmm. Yeah, and that came up, this all of government approach came up. We just hosted the American Climate Leadership Summit, and it came up a lot, this all of government approach. And we had a whole panel actually on mental health and climate change. And we had the director of the National Institutes of Mental Health speak on that panel. And he talked about that, that the National Institutes of Mental Health is going to be able to direct more research dollars towards climate change and the impacts of climate change on our mental health, especially among vulnerable populations, kids, how disasters are affecting kids' mental health and well-being. There was a new study out, I think I saw just today, about air pollution impacts on kids' mental health. And so we're really gonna, with this all of government approach, we're gonna see advances in research across the NIH, I think, which can really be that, that strong foundation for the policies, that policy change that we need to see. So Jessica, you already brought up HHS, and I know you want to talk a little bit more about it. And, just a couple of weeks ago, Healthcare Without Harm and other medical and public health organizations, Climate for Health included, sent specific recommendations on climate health and equity to the Department of Health and Human Services. So tell us a little bit more about what was in that set of recommendations and why it's so important for HHS to lead on climate.
I would love to, but before we leave that very first question about the first 100 days, we have to give a shout out about the United States' new nationally determined contribution to the Paris Agreement. I mean, this is an incredibly ambitious goal to achieve a 50 to 52% reduction in net greenhouse gas pollution by 2030. It's double the commitment that the Obama administration made. And this commitment really puts us on the path to avoid the most catastrophic health impacts of climate change. And the US is stepping back into a leadership position. And by putting out this ambitious NDC, the hope is we will see that with other countries, in the lead up to the UN meeting in the fall. And I think that really lays the foundation to say, we now have this ambitious goal. The work starts here. And that's a call to action for all of us to figure out how we're going to do that. And for Healthcare Without Harm, we work with the healthcare sector internationally. And in the US, the healthcare sector is actually responsible for 8.5% of the country's greenhouse gas emissions. And we need to do something about that. So earlier this month, we released something called the Global Roadmap for Healthcare Decarbonization. And it charts a course for worldwide zero emissions in healthcare while contributing to greater health equity. And I'll just give a little shout out for those listening that the website is healthcareclimateaction.org. And you will find the roadmap there. It's it's a great website where you can pull small pieces at a time. So definitely wanted to touch on that. Do you want me to roll into Health and Human Services?
Yeah, I guess unless Kineta you wanted to add anything on the 100 days or anything that we've talked about so far.
No, I think that's great. I think Jessica summed it up perfectly. And we're certainly here. We're certainly, the new administration is certainly going to make changes in terms of climate change and equity and health. So I'm on board. Let's go, and let's ready to make some definite changes in the next 4 years.
Awesome. Yeah, I think that's so important. Like, roll up your sleeves. Even though we have a really supportive administration, it is not time to rest on our laurels. And maybe we can, send people off with that inspirational message when we get to the end. But I so appreciate both of your sort of, hey, let's stay on task. Like, we have work to do. It's a great agenda. It's a great narrative, but let's, here's the recommendations, and here's where we can get to work and support the action that we need to see. So Jessica, dig in on HHS. What are they up to?
Yeah, and HHS is really going to need our help. Just for listeners who don't know a lot about the Department of Health and Human Services, it's really the principal agency for protecting the health of all Americans and providing essential health services. It's actually one of the largest civilian departments in the government, and it's got a budget of over $1.3 trillion, which accounts for almost 1 out of every 4 federal dollars spent. And it administers more grant dollars than all other federal agencies combined. The department has 11 operating divisions, including some that are well-known names like the Centers for Medicare and Medicaid, the Center for Disease Control, and the Food and Drug Administration. And HHS has nearly 80,000 employees, but fewer than a dozen have expertise in climate and health. And I think that's the call to action. They do need the support. Prior to this administration, there was only a small initiative focused on climate and health at the CDC, and that represented 0.0007% of the budget, something like 0.7/10,000%. So, as HHS ramps up to take on climate and health, they're going to need those of us in the field with expertise to come and support them. And really, the full engagement and accountability of this department is the linchpin to build a resilient, low-carbon healthcare system, and to ensure that we work to prevent the worst impacts of climate change, and that we simultaneously improve health outcomes and health equity while we do it. So I think it really all starts at the highest level, the Office of the Secretary, developing a comprehensive national plan to address both the physical and operational risks from climate change to public health systems and healthcare facilities, and to assist communities, public health departments, and safety net and rural hospitals to prepare for and respond to the risks of the climate crisis, including mental health and food insecurity, which are not often seen as part of addressing climate. And this plan also needs to encompass the decarbonization of the healthcare sector. And HHS is the ones to do it. They can push the healthcare sector to do it, and they can track those emissions. So I'll stop there. I'm happy to come back and talk more about the specific recommendations, Rebecca, but I don't want to go on and on.
Yeah, and I think I should invite people too. That sign on is still open, I think, for individuals at climatehealthaction.org. If you can check out, there's a lot of work going on in the climate and health sector to show your support for those recommendations. And we'll of course include all this in the show notes if you check it out below in the blog that we'll post with all these great resources that we're hearing about. And we'll provide opportunities for folks to really show their support for HHS leadership on this, because we know, for all of the great things that I think these optimistic feelings we're seeing in the first 100 days, we've heard a lot about, climate change as a job, as an economics initiative, as a jobs initiative, but really it's a health improvement initiative too. And that actually hasn't been as strong a part of the narrative that I've heard. And I think we can show that it should, there was ecoAmerica's recent research shows that actually for people, health ekes out slightly ahead of jobs in terms of, motivation for action on climate. And so we really need to make that health voice stronger to support climate initiatives and help the, the administration weave, put another, like to continue weaving in the health narrative to bring back that analogy. So yeah, thanks, Jessica. I think that's really so important. And the specifics that you got into, I think, are really going to help people understand, the need for more support on climate and health initiatives at HHS specifically, and that there's so much opportunity there. So Kineta, we've seen some great legislative initiatives on maternal health and climate change from Representatives Alma Adams and Lauren Underwood. What are your expectations from the executive branch when it comes to protecting the specific vulnerabilities of Black birthing people from the impacts of climate change?
And Rebecca, that's just a great question. Now, for our listeners, to tell you a little bit more about the Momnibus, to address maternal mortality and racial disparities experienced by Black mothers, Representative Lauren Underwood and Representative Alma Adams and members of the Black Maternal Health Caucus introduced the Black Maternal Health Momnibus Act of 2021. The legislation is composed of 12 individual bills and will advocate for 12-month postpartum Medicaid coverage, promote a diverse perinatal workforce, invest in rural maternal health, implicit bias trainings, so that every facet, amongst other things, so that every facet of the Black maternal health crisis is addressed, because we are in a crisis. The act itself is more expansive and includes 3 new titles this year, including the Protecting Moms and Babies from Climate Change Act, to address the impacts of climate change on maternal and infant health outcomes. As you may know, Black women are 3 to 4 times more likely to die from complications of pregnancy or childbirth than white women. This racial disparity persists regardless of age, socioeconomic status, education, or other factors. Now, as a result of climate change, temperatures across the US are increasing, and heat waves are predicted to increase in intensity and frequency. Alongside the impacts on pregnancy, heat kills more people than all other weather-related deaths combined. So for Black women, pregnancy outcomes are exacerbated by the climate change. Heat exposure plays a detrimental role in one's ability to have a healthy birthing experience. And this, just really must change. A study recently published by JAMA Network examines the outcomes of 33 million pregnancies to determine the correlation between heat exposure and birth complications in America. And the results from the study indicated that the higher rates of heat exposure contributed to premature birth, low birth weights, and stillbirths amongst women. Now, this is a crisis that's already experienced in for Black women in our communities, but the climate change just exacerbates this. And so I'll just throw out a few statistics from some of the studies. One study said that preterm birth and exposure to heat found that Black and Asian mothers had larger impacts from heat exposure than white mothers. Black women had more hospitalizations due to heat exposure during their pregnancy than other women. Also, you look at marginalized communities, and they're more likely to reside in urban neighborhoods that are referred to heat islands. These areas are significantly warmer than rural and suburban communities, and temperatures are higher because there are fewer trees that provide shade, and the buildings and the asphalt and the roads just really capture the heat. So another study really quickly found that surface temperatures in redline areas, and for those of you who don't know what redlining is, it's when neighborhoods are adversely impacted by the racially discriminatory government practice or policy of withholding services, financial or otherwise, for residents in certain areas where they reside because of their race or ethnicity. So in these redline areas, on average, they're 2.6 degrees warmer than non-redline areas, and in some cities as high as 7 degrees warmer. So at all, Black birthing people are disproportionately affected by the herring effects of climate change. But what's really interesting is that, previously, most of these climate change discussions, often miss the social justice concerns, even though these weather events and extreme heat are often unevenly and unfairly distributed, impacting those with the least resources and communities of color. So when the Protecting Moms and Babies Against Climate Change Act is introducing the Momnibus, and it centers equity in the lived experiences of some Black women and legislates for education, grants, and strategies to that end, I believe we're poised for real change in regard to this issue.
I love the Momnibus. That's just a great name. And, I know the study you're referring to, and I think that is such an important piece to get out there, that these redlined areas in cities across the country don't have trees. They are significantly hotter. Many people don't have air conditioning. And as every city in this country gets hotter due to climate change, many places that prior to this didn't need air conditioning, now people do. And extreme heat is really the key extreme weather event that is killing people across the country. I'm a trained nurse, women's health nurse practitioner, and I worked and ran a women's health center for many years. So taking care of women is very close to my heart. And certainly women of color have always had disproportionate health outcomes. And you're right, climate change is just making all of those worse. And, from where I sit and the perspective that I come from now, thinking about health systems, what's the role of a healthcare system and a hospital and community in working on these issues? Because health systems have to think about resilience. They have to think about their facilities. We need to keep the lights on. They need to be a safe haven. And often the most vulnerable, who are disproportionately impacted, need those hospitals during those extreme weather events. Hospitals also need to keep their lights on after the extreme weather events. What we saw in Hurricane Katrina is that the Safety Net Hospital didn't reopen. We think that contributed to climate migration because hospitals are often one of the largest employers in communities. But that's just the beginning of resilience, right? The hospital needs to think about what's happening outside its four walls. So what we saw after Hurricane Harvey is that Texas Medical Center, all those emergency rooms stayed open because they'd invested $50 million in those buildings, but the roads in Houston were flooded. So people couldn't get there. And then what's the next level of resilience, which is I think what you're really talking about, Kineta, is the health of the population. So what's the role of the health system? And we are working this year with our Healthcare Climate Council, which are 18 health systems that really have committed to implement innovative climate solutions on community resilience projects, where how do health systems invest in weatherization and energy efficiency in low-income homes in the communities they serve? How do they do things like put in air filtration or think about a healthy homes assessment layered on top of those types of things? And those kind of projects will help address the impacts of extreme heat.
Yeah, what I'm hearing from both of you is that, the US is poised to lead on cutting our emissions, leading on climate, and through that, actually, in part, at least, leading on reducing infant mortality. Because I know for how much we spend on healthcare in this country, Kineta, birth outcomes are, inequitable. And also we have a relatively high infant mortality rate for what we spend on healthcare. Is that right?
Yes, yes,
Yeah.
absolutely.
Yeah. So I think, we're here to talk about the administration and the first 100 days, but also like what can we do moving forward, right? So like I think those are two areas where we can really lead, and that connecting these issues and understanding the ways that they overlap, and understanding the ways that we can multi-solve for by understanding the root causes of inequity and systemic racism, like redlining that Kineta mentioned. The way that we understand the root causes allows us to fully embrace solutions that will achieve health equity, and dismantle systems of oppression that have been baked in since our country's founding. And so we could, I imagine, talk about this for quite some, like the next 100 days, right? But I just want to thank you so much, Jessica and Kineta, for this fantastic discussion. And just one final kind of lightning round question. Where do we go from here? How can our listeners take action to build climate solutions in the next 100 days, in the next 4 years? Kineta, why don't you start us off?
Well, yes, there are a few things that you can do, I guess. And from the average person on the street in your neighborhood, I would say to educate yourself, talk to a friend, get further involved, be a leader. If this is really passionate and this is your passion, environmental issues, go out and be a leader. Talk to your elected officials. In the next 4 years, what I can always say is vote, 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 vote. Vote in your local, state, and federal elections. Educate yourself on elected officials, their record, where they stand on these environmental issues. Hold them accountable. Policy is a key mechanism for change. So we have to engage in the process and just to move towards solutions for these issues that are affecting our communities. So that's what I would say.
Mm-hmm. Yeah, Jessica.
And I'll take the frame of really from health organizations and health professionals who are working on these issues. We have to get health systems across the country to commit to net zero emissions. We need to get health systems to use their purchasing power. We're 18% of the GDP, to get their supply chains to decarbonize. They play an important role in decarbonizing energy, buildings, transport, pharmaceuticals, agriculture. We need to support the administration to put policies and programs in place to support the decarbonization. And we need the government to incentivize innovation and a circular economy because of so many emissions coming from all the stuff that we use, particularly in healthcare. But we also need to make sure all that is linked to resilience. So we need to link zero emissions to health equity and climate resilience to make sure these things are done right. We need to align things that are cost effective with achieving the UN Sustainable Development Goals, and to make sure that what we do improves access to healthcare delivery and fosters resilience. And we need, just like we need, and I think Kineta, the call to action to get yourself educated, we need to train our health professionals to be climate leaders and climate implementers, because we know the power of the voice of health professionals in this country and the difference they can make. So they can influence both their healthcare institutions to step up and take direct action. And I would put a pitch in to have your health systems join the healthcare climate challenge. And they can also be a very important voice in policy advocacy at the local, state, and federal level to get involved. So all hands on deck. We don't know how long we have with both an administration and Congress who are ready to move. So let's do it now.
All right, you heard him. Roll up your sleeves, hold your elected officials accountable, vote, and then hold them accountable. Get educated. Healthcare Without Harm has resources. Black Women's Health Imperative has resources. Climate for Health offers our ambassadors training program if you're a health professional and want to get trained. There are so many resources available to you if you want to get engaged. Join your local organizations. Roll up your sleeves. Let's get started. Don't hesitate. Just jump in. So thank you so much, Jessica and Kineta, for spending time with me today and to share your wisdom and concrete actions that people can take. Please join us every Thursday for live episodes of Let's Talk Climate. Engage with us online with the hashtag Let's Talk Climate, And be sure to subscribe and follow us on our social channels for the latest thought leadership, resources, and episodes on climate action and advocacy. From all of us at ecoAmerica and Climate for Health, thank you. Please join me in caring for our climate to care for our health. Stay well, stay safe, and get active.
Yes. Bye.
Thank you.